Hi, it's Brian Newman with the Spotlight of Business Owner Show, and today we're thrilled to have Emily Hines. Hi, Emily. How are you?
I'm good. It's nice to meet with you, Brian. Thanks for having me.
Yeah, my pleasure. Yeah, she's got a fabulous business. It's called Flourish Together Therapy. So, before we get into it, Emily, can you let us know how did you get into that business?
Yeah, interestingly, very unique is I come from a long line of therapists. My parents were therapists, so interestingly, I picked it up as well.
Oh, interesting.
Mhm.
Oh my God. No, and do you meet in person? Do you do it remotely on Zoom or?
Both, yeah, we offer virtual and in person in 5 different states.
Oh, really? Oh,
Mhm.
that's interesting. My God. So you guys are pretty large.
We have 5 therapists. A lot of us meet virtually to other states because we're all located in Arizona.
Oh, okay. Oh, very cool. Yeah, what are some of the common reasons why people get therapy?
Yeah, that's a great question. So many different reasons. Life transitions, people are getting married, divorced, starting school. Maybe they've experienced a trauma, a car accident, or the loss of a loved one, or just to kind of have some ideas to bounce off of someone else or to get some different insight.
Oh, okay. Oh, interesting. And then who do you work with? Like what kind of who's your ideal patient?
Mhm. So we have 5 different clinicians at our practice. So I think the ideal patient would be different for all of us because we all have such different skills and training. We work with anyone from age 2 to 105. I'm trying to think of
Oh, wow.
um, so a very wide variety of folks, anxiety, depression, mood disorders, and just life transitions.
Oh, okay. Yeah, I
Mhm.
was laughing, no, because yeah, I know even my stepmother's 98,
Yeah.
so people are living to an older age and
Mhm.
believe me, they have issues that, they want to discuss.
Yeah.
No, but yeah, I'm just curious, like what specialties do you guys specialize in at your office?
Yeah. So I specialize in trauma, chronic pain, chronic illness. That's a topic that's really kind of close to my heart. And some of the other therapists at my practice specialize in grief and loss and bereavement, losing someone, losing your house to natural disaster, or losing a job. We also have another therapist who specializes in women and teens. And some of the issue specific things that they struggle with. And then I have a couple of other therapists that are really trauma specific. So if something has happened, or if you just have a difficult time moving through something that's happened in the past or even recent, so a wide variety of things.
Oh, okay. I noticed that you have these initials after your name, MA and LPC. Can you explain those to the viewer audience?
Yes, absolutely. The MA in my name means that I have a master's degree, and the LPC stands for Licensed Professional Counselor. It means that after my master's degree, I've fulfilled all of the board requirements to becoming a licensed professional counselor. I can practice without supervision. And so some of those look like MSW, which is a master's in social work, and then a licensed social worker. So just a variety of different initials. And some of our clinicians are social workers and some are therapists.
Oh, okay. Okay. Where are you located?
We have 2 offices in North Phoenix, right off 101 and North 19th, and then in the Happy Valley area.
Oh, okay. No, also, I know in the past, going to a therapist always had a stigma attached to it, or not always, but like back in the day when I was younger, you know, I don't know, it wasn't as widely, looked positively upon. Can you just speak on that for a few minutes?
Yes, I love this question because it's so relevant. Often I hear people are worried about seeing a therapist. It's very stigmatized, and not so much anymore, which I'm really glad about. But some people still have really like a lot of concerns about it. I think some of the important things to know is that we see people for a wide variety of things. Some people will come in and say, Nothing's particularly happened to me. I just need someone else to bounce these thoughts off of. And when I hear it out loud, maybe I'll come to my own conclusions. And often that does
Yeah, I
happen.
love it. Yeah.
And then some people are worried about receiving a diagnosis when they come. That's something that we take, seriously. We don't want to give a diagnosis that would be really hard to hear. So oftentimes you might see things like adjustment disorder with anxiety because we're all experiencing adjustments in our life,
Uh-huh.
or generalized anxiety disorder. So it's our goal to not diagnose with, really life-changing diagnosis. And if we're not using insurance at all, we don't have to even give a diagnosis, but diagnosing is, it's required if we're going to be billing insurance.
Oh, okay. And speaking of that, yeah, what are the different options to pay for the services?
Yeah, we are a network with a couple of different insurance companies. So we bill insurance, United, Aetna, Cigna, Blue Cross. We're also in the process of Medicare, and then also paying out of
Mm.
pocket. Not every practice accepts insurance, but it's important for us so that people can access quality care using their insurance.
Oh, okay. All right. Yeah, so again, I want to remind our viewers that we're talking to Emily Hines, and she's got a great business called Flourish Together Therapy. What's the best way that people could reach out and sign up with you?
Mhm. They can use the phone number listed on your screen. That rings directly into my phone, and we can have a call and talk a little bit about what you're wanting to accomplish, and we can schedule together. They can also visit the website and inquire by submitting a contact me form, and then I'll reach out to them.
Okay. And yeah, I just want to let our viewers know, go to the website and check it out. It's very detailed. You get to like read a bio on each of the three therapists. You know,
Mhm.
you're the founder, I understand, right?
Yes.
Oh, okay. So who are the other therapists in the office?
There are therapists that have seen that we're hiring because we have a lot of inquiries. And I found that I wasn't able to help everyone. There's only one me and only so many hours in a week. So I had posted some jobs and took some time to really find the best candidates, someone that can serve the people that we're getting calls from. So they're licensed therapists that are able to sort of use their niche within our practice as well.
Oh, okay. I noticed you guys also do couple therapy. Like, what are some common reasons why couples would come in and see you?
It's an excellent question. The biggest thing that we get is communication. Couples want to communicate better or more efficiently. So that's a big request. Or, a new marriage, getting ready to get married, or separation, wanting to make sure that's the best decision for them.
Oh, okay.
Mhm.
Yeah, and then again, I know you had mentioned like an range. What is like the youngest people could start getting therapy and actually get help?
Mhm. A very big range. We've had folks as young as 2 and folks as young as 102. So wide range.
Oh, okay. Oh, interesting. Yeah, so I know on your website, I was reading you have different types of sessions. I know one of them, I got to look up IFS
Mhm.
versus ACT.
Mhm.
What are those about and
Those
the
are
difference?
different. Yeah, those are different treatment approaches or theories that we use within session. IFS stands for Internal Family Systems, and ACT stands for Acceptance Commitment Therapy. There are different types of ways that we can look at the problem we're presented with. IFS uses different parts of us. So, for example, if we get really mad about something or something feels particularly triggering, like traffic or something, we might
Uh-huh.
say, what part of us is coming up? What part is just feeling triggered? And then when we work with that part, and that part is listened to, and we can kind of resolve what's going on there, we might not be as triggered in the future. And then ACT is a way to sort of accept our reality. We don't have to particularly approve of it, but we can accept what's happening to us.
Oh, okay. Yeah, and do you do therapy in conjunction with medicine?
Yes, we often use other practices and we'll send a referral and say, at the point where we're at right now, maybe medication could be helpful. That's always up to our client, though. Some people will say that's never for me, and that's okay too. We can always work with that. But we use a lot of psychiatric nurse practitioner practices or different psychiatrists in the area where we can collaborate together about the best medication for them.
Oh, okay. I know, a lot of times, like even in today's, society, I'm running across people with ADT. Am I
Mhm.
saying that right? ADT, memory loss, and even anger issues. Like, do you work with people like that have these problems?
Yes, definitely. There are different therapists within our practice that specialize, one within ADD, one with memory loss for a variety of different reasons, anger, and there's different therapy approaches we can use, just like as we talked about IFS or ACT. There's different ones for anger or memory loss and ADD and things like that.
What's a therapy session
Mhm.
like in your office? Yeah.
So the first session, we're going to give you, before you come in, a whole history of your background so that we have it for the first session when you come in. We're going to spend the first session going through that in detail. We want to know a little bit more. We want to know about your goals. And then together, we're going to create goals together. It's the best way to measure if we're being successful, because people want to look back on the last month and say, have we been successful? Are we doing what we wanted to do here? So creating a small treatment plan together about what we want to accomplish is the best way. And then the therapist can help and say, what will our therapy sessions look like moving forward every time we meet? How will I help you structure those? Things like that.
Oh, okay. And then, I know, like, I guess it depends on what they're coming in for, but how soon after they start seeing a therapist do you see results?
It's different for everyone, as we can imagine. But even in the first week or two, people will say, it's just so nice to have somebody to talk to out loud about the thoughts that I have. And now that I'm hearing my thoughts out loud, they make more sense to me. So just having that support, and what we know too about research and being able to be successful with our mental health is that support is the number one thing that's going to help people be successful with making change.
Oh, okay. All right. So, yeah, are there any final uh, words of advice that you want to give the audience?
Um, I would just say if it's something you've been thinking about and you're hesitant or you have some of these stigmatized thoughts, just call and let's chat together, because sometimes just talking about it and being kind of forthright with what you're hesitant about can be really helpful and in feeling confident about getting support.
Well, and I know, looking back at my life, and other people's, I know, yeah, it's important to be able to talk to other people about issues that you're going through. You know what I mean? And sometimes you don't want to like talk about private issues, so it's good to go to a therapist.
Mhm.
Um, can you let people know one more time, like what's the best way that they could reach out to you?
Yep, using my phone number there on the screen behind you, that rings directly into me, or visiting the website and creating a contact me form so that I can reach out to them. We can spend a few minutes on the phone talking about what is going on, and how we can best help them.
And what's that website?
It's www.flourishtogethertherapy.com.
Okay. And for those of you that are listening, if you're not living in Arizona or the Phoenix area, she does stuff remotely, right? You do it on Zoom, I guess.
Yeah, it uses Zoom, and we are able to meet with patients in Arizona, Michigan, Florida, Washington, and Pennsylvania.
Oh, wow. How does that is it as effective as seeing you in person?
Yes, and in fact, some people prefer it because they get to just have their cup of coffee and just be really cozy in their house. They don't have to go anywhere, and it's still just as effective. And some of our therapists are licensed in some of those different states, so that's why we're able to see different people from those states.
Oh, nice,
Mhm.
nice. All right, well, Emily, yeah, it's great to meet you, and thank you for being on the show.
Thank you for having me.
All right, thank you.